back. This is Boomer Life on CL 650.
Welcome back to the program. Sterling Fox in studio with Dr. Amin Javert from FalseCreek Healthcare Center. Dr. Javert is an otolaryngologist who specializes in sinus procedures. He is a professor of medicine in the Department of Surgery at University of British Columbia, his alma mater, where he graduated as a med student more than a few weeks ago. Also, Dr. Javert is practicing at FalseCreek Healthcare Center since his return to Vancouver back in 2000, and also works at St. Paul's Hospital. You're a busy man.
Yes, absolutely.
Well, and busy is good, right?
Yes, absolutely.
I wanted to talk to you, and I mentioned before we took the break, Dr. Javert, about this chronic sinusitis. It seems as though, and I described it somewhat flippantly, and I didn't mean to sound flippant, but as a kind of a bad head cold that somehow or another you learn to live with. And in the case of a lot of patients, that's what we do. We just kind of, well, it's uncomfortable. It's frequently painful. We don't sleep very well. The quality of life has diminished noticeably, but we somehow or another just struggle along with it, don't we?
Absolutely. I tell my patients it's like putting a frog in water and then very slowly warming the water. And before you know it, you're boiling the frog, and he hasn't realized the water is so hot, and he dies in the water. Mm-hmm. But if you take a frog and put him in boiling water, he's just going to jump out.
Of course.
So that's exactly a very close correlation to what happens to our sinus patients. They just learn how to live with it.
Right.
And it's kind of strange because a lot of the times their family members have no compassion for them because it's just like having a cold. And they're like, well, why don't you just blow your nose? Exactly like what you were saying.
Sure, yeah.
And it actually creates a lot of emotional issues with these patients.
And this is the other dimension to chronic sinusitis. This is the psychological dimension, because in many cases, nobody gets what's wrong with me except maybe my doctor, and I get no sympathy from anyone else.
Correct. It's isolation. They feel very isolated, and it's very hard on their emotions. And a lot of these patients get very depressed. And it's very, very important. I find it's really important when a person comes into my office with chronic sinusitis, if they have their spouse with them, they usually do a lot better compared to if they come in alone. If they come in alone, it means that the other person just doesn't know what their partners are going through. Mm-hmm. So a family member in the room is really important, because then that person has support. And if that person has support, they'll do a lot better dealing with this disease than if they don't have any support.
But I'll bet you more often than not, people come to you with this debilitating condition who report no sympathy in their lives. On the workforce, you're turning into a malingerer. You're missing too many days. Your job's on the line, Buster. Mm-hmm. And then the family just thinks you're a whiner.
Absolutely.
And here you are with a legitimate, quite nasty medical condition.
Mm-hmm. Mm-hmm. And that's a real problem. These patients, you feel very sorry for them. Some of them get into very depressive states.
Right.
I had a patient when I was training in Georgia who jumped off a bridge and killed himself.
Oh, my.
It was very sad. His wife never showed up with him, and he felt very isolated. And it's very sad when that happens.
Now, you're lucky at FalseCreek Healthcare Center, because you have this incredible, talented team of colleagues, dozens, if not hundreds of them, who specialize in every medical activity known to man, and that includes psychologists and psychiatrists, people who can help with emotional distress.
Yeah, and that's true. It's very, very lucky to have such a great team there, and it is quite often that I'll talk to a patient about seeing someone like that for support, and I think that's very, very important.
Right. I wanted to ask you about some of the other activities that you involve yourself with, Dr. Javert, because we've talked almost exclusively. Well, we started about allergies, and thank you for that, because here we are, and it's helpful to hear someone kind of sort it out for us and at least help us to understand what all this discomfort is about. And then we've talked about the chronic sinusitis and the remedies that are available for that. What other sorts of medical sinus-related activities do you have time for, if any at all, you busy guy?
Well, the biggest thing is nasal obstruction. A lot of people come in with nasal obstruction. They don't necessarily have sinus disease. They just can't breathe through their nose.
Oh, okay.
And a lot of these patients...
I thought you were talking about a little kid who stuffs a Lego up his nose or something like that.
That can happen too.
A GP can pretty much take care of those, can't they?
That can happen too.
Right.
But it's really the people who have full lives, but they can't sleep at night because they can't breathe through their nose and they breathe with their mouths open. It's not necessarily because they have an allergy. It's nothing to do with an allergy.
Right.
They just have a broken nose.
Okay.
It's called a deviated septum.
All right.
And almost
and these people snore a lot, I'll bet.
correct, because they breathe with their mouth open.
Right.
And so if you have a deviated septum, that doesn't necessarily mean that you can't breathe, but a proportion of those patients are so badly deviated that they can't breathe. Most of us will break our nose at least once by the time we are teenagers, and most of us, it's not a big deal. But about a quarter of those patients, it becomes such a problem that they can't function. And they become snorers, they don't sleep well.
So this deviated septum business results from having a broken nose in the first place that
Correct.
never heals properly.
Well, it heals improperly. It feels
Okay.
bent. And so these patients will come in and complain that they can't breathe through their nose.
Right.
Very simple fix. It's a simple surgery. You fix it, and immediately their breathing gets superb.
Okay, and it's not that balloon that you were talking about
No,
earlier.
no, this
is
is actually,
it less complicated than that?
No, this is actually a general anesthetic.
Okay.
So it's a proper surgery.
Mhm.
It's a short surgery, but it's very fixable very quickly.
Okay.
And so these patients benefit a lot from a very simple procedure.
And immediately as well.
Immediately. The other thing we have in the nose that we haven't talked about the anatomy of the nose, but there's turbinates in the nose, and those are big structures that, the word comes from the word turbines,
Mhm.
and they're there to moisturize and hydrate and regulate temperature as it goes through your nose. Remember I told you that the nose is like the upper airway or the guard to the lower airway, which
Yes,
is the lungs?
the lungs, right?
So the turbinates play a big role in protecting your lower lungs and your airways. And the turbinates can get very large. They're spongy tissues, and they can get huge. And if they get too large, a lot from allergies sometimes,
Oh, okay.
they can plug you up. And so one of the other things that we do, and FalseCreek has this very special technology of shrinking those turbinates using a co-blader. So co-bladers are cold. The word comes from cold ablation. So it actually vaporizes the tissue in the turbinates without making any cuts and without any bleeding. So you just put a probe in the turbinate and you turn it on, and it vaporizes the inside of the turbinate, and it shrinks, and this patient's breathing becomes better almost immediately.
Wow.
So there's some very cool technology that we use to make space in the nose so patients can breathe well. If you look at a crowd, there'll be about 10% of the crowd which will keep their mouth open to breathe. And those are the ones that are not breathing well through their nose.
Right.
And that's abnormal.
Well, we used to, there used to be, you would refer to people as knuckle draggers and mouth breathers because that was a sign of poor education and social status and all of that sort of thing. But in some cases, people breathe through their mouths because they can't breathe through their nose. And so there's no other issue other than that simple medical fact, right?
Exactly. And very easily fixable, too. So that's another very big aspect of nasal problems. It's not allergies, it's not sinusitis, it's just simply a plugged nose.
Mm-hmm.
And patients will come in and say, please let me breathe, I need to breathe, and that's very important.
Right. And is it a surprise to some of these patients who've been living with this condition, a plugged nose and inability to breathe properly, in some cases I'll bet for more than a while,
Mm-hmm.
is it a surprise to them when they discover how easily fixed the problem can be?
I wish you would be in the room with me sometimes when we take those splints out, because it's just like magic. Like they feel like they've never had this much air. They feel so good. They start sleeping well. Their energy comes back. I had one fellow who was in his 70s who finally came in to see me, been living like this all his life.
Right.
He fixed his nose, and he came to me a couple of months later, gave me a huge hug, and he says, I feel like there is air coming out of my pores. I've never had this much good air go through my body, and it feels so good.
Right. And the message, in addition to that, Doctor, is it's never too late either. This is BoomerLife, so we're talking to a group of people who are, shall we say, older than 45. And so you get to a certain point, guys particularly, men do this more than women. Well, suck it up, princess. You just got to live with it. That's the hand you've been dealt. You got to play it. And that's it. Well, it doesn't have to be that grim at all, does it?
No, not at all. And you're absolutely right about men. Men will not come in to fix themselves up until it's it's so late and it's so fixable. So, you know, when you fix them, they're just so appreciative.
Right, right. And so, again, to those listening at the moment, keeping that never too late theme in mind, and the fact that these procedures are so swift and so incredibly effective. And, Doctor, it sounds like in a lot of cases, it's something you can go and have done and be home that night.
Yeah. In fact, all our patients go home the same night.
Okay.
They don't stay in the facility at all. It's very simple. They come in, they have their surgery, they recover, and they go home. They take a week off work, and that's it.
Fantastic.
That's all they need time off for.
Wow. There is hope, and it is never too late. Our guest, Dr. Amin Javer from FalseCreek Healthcare Center, and we're back with lots more here on Boomer Life after this.
Celebrating the baby boomer lifestyle. This is Boomer Life on CL 650.